Do you frequently feel like your heart pains sometimes? Or maybe you get sudden rashes that come and go for no clear reason. What if I told you these clues might point to a hidden problem with your blood? Meet eosinophilia, a condition where your body makes too many eosinophils, which are a type of white blood cell. Normally, these cells help fight infections, especially parasites, and play a role in allergic reactions. But when there are too many, they can damage your organs, like the lungs, heart, or skin. Think of it like firefighters showing up for a tiny spark and accidentally flooding the house. If you often feel tired, have unexplained rashes, or breathing trouble, it might be worth checking if your eosinophils are overworking. So why do these eosinophils go into overdrive? It's like asking, why are so many police at a scene? There must be a reason. The most common causes include allergies, like asthma or hay fever, infections, especially parasites. Imagine worms sneaking into your body from dirty water or food. Certain cancers, like some blood disorders, or autoimmune diseases where your body attacks itself. Some medicines, like certain antibiotics or anti-seizure drugs, can also trigger it. For example, imagine you start a new medicine and suddenly develop a rash and fever. Your doctor checks your blood and finds high eosinophils. That's a clue the drug might be the villain. In rare cases, your body might just produce too many eosinophils on its own, a condition called hypereosinophilic syndrome. Now, how would you know something is wrong? Eosinophilia often doesn't shout, it whispers. You might feel normal, but a blood test reveals the truth. However, if symptoms show up, they depend on which part of your body is affected. If your lungs are involved, you might wheeze or feel short of breath, similar to asthma. Skin rashes, itching, or swelling could pop up like a surprise party, no one invited. Stomach issues like diarrhea could be parasites. Heart problems, though rare, might make you feel chest pain or very tired, like your battery won't hold charge. Here's a quick test. Have you had long-lasting fatigue plus itching or breathing trouble? Not just once, but repeatedly. It might not be stress. It might be eosinophilia silently at work. First, they do a simple blood test called a complete blood count (CBC) to count your eosinophils. More than 500 per microliter, that's a yellow flag. Then, they dig deeper. Why are they high? They might check for parasite stool tests, look for allergy skin or blood tests, or image your lungs or heart. If needed, they might take a tissue sample biopsy. Once the cause is found, treatment starts. Allergy-related antihistamines or inhalers. Parasites deworming medicine, like a bouncer kicking out intruders. Severe cases, steroids like prednisone calm down the immune system. Think of steroids as the peacekeepers telling your eosinophils, calm down, there's no war here. The key is treating the cause, not just the numbers. Can you stop eosinophilia before it starts? Yes, especially if you know the triggers. Avoid unknown medications without doctor advice. Traveling to areas with poor sanitation, be careful with food and water. No raw veggies in places with dirty water. Use mosquito nets and clean surroundings to avoid infections. If you have allergies, manage them well. Use your inhaler, avoid pollen, and check air quality. It's like wearing a helmet. You might never need it, but it saves you when danger hits. Also, regular health checkups can catch high eosinophils early, even before symptoms appear. Prevention isn't magic, it's smart daily choices. Scientists aren't stopping. Recent studies are finding new genes linked to eosinophilia, helping doctors identify high-risk people earlier. New drugs, like mepolizumab or benralizumab, target eosinophils directly. Imagine a smart missile that only hits overactive immune cells. That's what these biologics do. They help severe asthma and rare eosinophilic diseases with fewer side effects than steroids. Clinical trials are also testing how diet and gut health affect eosinophils. One trial even showed that changing gut bacteria might reduce eosinophil levels. So the future isn't just about fixing symptoms, it's about understanding why they start and stopping